It's hard for people who are reasonably well off, middle-class people, people with jobs, people with insurance, to really understand how many people struggle with being able to pay for simple health care.
But I think in a community where you have poverty, and because of that economic picture, you just don't have resources. So even if people are financially well off, they may not have services available locally.
I just felt like that we were blessed to have White House Clinic here, and still got it.
The patients that come in here, they're not just patients off the street. They're our friends, they're our family, and we treat them like that.
White House Clinics was founded by Dr. Philip Kurd in 1973. He was fresh off some service in the Peace Corps and looking to make a difference in the community and to use his medical training to serve a community that needed a physician.
And I had the idea at that time that I wanted to have a nonprofit organization that would be somewhere in Kentucky in a community of need.
And at that time, Jackson County had one doctor, and so having a clinic set up in McKee, there just wasn't access.
And then we needed a place to practice. So the other, Dr. Peterson, there was the health department in McKee, and then to the right was this dwelling house. It was a white house.
He was trying to come up with a name, and he was thinking about something, Jackson County Health Services, and one of the health department employees said, "Dr. Kurd, you can't call it that."
She said, "Listen, you know, that's what we call ourselves. We're the health department, but we're called Jackson County, blah, blah, blah." She said, "Now listen, that's the White House. Why don't you call it the White House Clinic?" And that was it. That was the end of it. We've been ever since the White House Clinic.
I think we solve an access problem. In rural Kentucky, recruiting physicians to a community is very difficult, and a lot of these communities wouldn't have somebody providing care locally if not for the White House Clinics.
As I got to learn more about it, it was clear that that really fit what I felt like I needed to continue to do in the community I'm in. I really enjoy practice in the rural setting. It's been my hometown. To provide that same service there, facilitated by the White House system, has been just a great opportunity.
And I think it's spectacular that not only are we meeting medical needs, but we're also able to expand the scope of services that we provide to add dentists, dental hygienists, pharmacists, mental health therapists, really a full complement of health professionals to help make communities healthier.
And to have all that under one house where if they qualify for sliding fee, they can get medical, they can get dental, they can get their pharmacy, so they can actually afford their medicine to take care of their conditions, has just been a true blessing.
Over the past 40 years, we've been able to expand on Dr. Kurd's vision. We now have 6 clinics serving 4 different counties, and we provide a full complement of healthcare services.
You know, a lot of people know who White House Clinic are. they come and hunt us down.
Our group at the White House Clinic, the one here in McKee, I know it's just like I have never worked with a bunch of employees that have bigger hearts. I mean, it's just like if it comes to any of the needs, special needs for our patients, I mean, everybody will just go the extra mile.
My grandmother had cancer, and she was really, in a lot of pain. I remember Dr. Kurd coming to my grandfather's house and sit with her and help her. And I just remember thinking, wow, he must care a lot because he's coming here.
That's another thing that inspires me is I'm surrounded by people who also seem to want to give the most they can to the people that we serve. And that's inspiring every single day.
I'm excited about the future of White House Clinics.
I'm proud to say I work at the White House Clinic. I know what we do. I know what we provide.
You know, by serving them and by helping those meet those needs and remove those barriers to getting care and getting healthy, we're improving our communities. We're improving the economy. We're improving, the health of the community in general.
I'm just proud that that Dr. Kurd had the vision to establish a clinic in this area.
You know, celebrating 40 years is a big deal. And I think that our communities over the years have really learned to depend on White House Clinic as a community partner, and that's certainly something that we will continue, and we're glad to be able to be that partner.